Hi, my name is Dr. Ileo-Cecal. Welcome back. And here we have our friend Angela. And today we're going to be talking about something called open ileocecal valve syndrome. About 95% or even 100% of my patients have this digestive imbalance, and I've had it in the past and I've had it even fairly recently, so it's pretty common. We're not here to pick on Angela, we're here to help Angela with her health. So we'll do a bunch of demonstrations, and real quickly let's review what the ileocecal valve syndrome is, because you're probably watching this thinking, what the heck is this Dr. Ileo talking about? So what ileocecal valve syndrome is that there's a valve at the bottom of the small intestine where it leads to the large intestine called the ileocecal valve. The small intestine is made up of the duodenum, the jejunum, and the ileum. So at the bottom of the ileum is the ileocecal valve. So the beginning part of the colon is the cecum, the ascending colon, the hepatic flexure, the transverse colon, the splenic flexure, and then the descending colon, and then the sigmoid colon, and then the anus and the bowels of Houston are right above the anus. And when somebody has trouble with their open ileocecal valve syndrome, they tend to be somewhat toxic because the valve at the end of the small intestine where it leads to the large intestine, the ileocecal valve, tends to be flaccidly open, and because it's open like that all the time, the toxins from the fecal material go into the rest of the digestive tract, and the person becomes toxic, their whole body becomes a bit toxic. And then the other trouble with the valve can be when they have it spastically shut all the time. That could be either this ileocecal valve over here, or it could be the valves of Houston, which are actually a part of the anus, but the person feels it over here. And I don't want to overcomplicate it like I've already done. My apologies, but I'm just trying to be thorough. You know the way doctors that are good, they're thorough. So let's start helping Angela with her health. Now, the thing that I've been taught relates to ileocecal valve by my mentors is when a patient comes in and she has pain, she or he has pain, inflammation, and swelling, a sudden onset of pain, inflammation, and swelling, no known cause, then that's pathognomonic. That's a word that we use for meaning, that means that the person probably has the thing that we're looking for. That's almost the same as having ileocecal valve syndrome. It could be something different, but chances are really good that they have trouble with their ileocecal valve. Do you happen to have any pain or inflammation or swelling anywhere in your body? If you don't mind me asking.
Not that I feel anything right now.
Okay. So we'll go and we'll look for pain, inflammation, and swelling in areas maybe that she's not aware of, because a lot of what causes pain would be emotions. The pain centers in the brain are called the limbic system, and those centers relate to emotions. And so again, pain, inflammation, and swelling, if the person is emotionally really doing great, they may have pain but just not notice it because their emotions are nice and stable. And so so let's get right to it. So pain, inflammation, and swelling. The other thing that the ileocecal valve syndrome relates to is diet, allergies, parasites, and emotions. So we might deal with a few emotions here and there. So go ahead and if you want to lie on your back, that would be great. Next. We'll do some muscle tests. First we'll see if there's any painful areas anywhere in Angela's body. By the way, these areas might hurt a lot. I'm not trying to pick on you or anything. I'm just doing that demonstration. So as soon as I stop touching them, they shouldn't hurt as much anymore. Okay. So is that at all tender in there?
Yes. Ouch.
Okay, so that's probably, we don't know yet what's going on, but maybe that's bladder 58. The open ileocecal valve syndrome is an imbalance, and so is the closed. They're an imbalance between the bladder and kidney meridians. So that was bladder 58. And what about that? Is that painful?
A little bit. Not as much as...
Okay, so thank you very much. So we're going, Angela, thank you very much. So we're going to the exact same spot, bladder 58, and she doesn't have the same pain that she had on this side. So because I have all this extra clinical experience, I know that that's the open ileocecal valve syndrome. I'll kind of demonstrate that a little bit more, but I don't want to get too carried away because people filming me have told me I do get carried away with these types of things. So what I want you to do is just push straight up towards that back wall there really hard. Breathing. Okay, good. We'll try doing that on the other side also. Push straight up towards the. Thanks. Okay. So those muscles are working okay, and that's good to know. And go ahead and kick straight up into my hand real vigorously, breathing in and out. And that muscle works pretty well, and that's great. Oftentimes when a person has the ileocecal valve syndrome, that muscle doesn't work well. I'm going to try to do this, not bring my back to the camera, but doing my best here. So kick up here, real hard, breathing. Okay, and then that one works pretty well. And again, it's the same one. That muscle just happens to relate to the small intestine. It doesn't mean Angela's small intestine is perfect or anything. I just thought I'd share with you that relates to the small intestine. So go ahead and you're going to push your knee into my hand back towards the back wall there. Push, push, breathing. So that one isn't locking properly. And push back towards the wall back there. And that one's not locking properly. So go ahead and put a hand there and there. And those also relate to the small intestine. And remember, this is a ileocecal valve problem is a problem with the small intestine where it meets the large intestine. There's a valve there. Go ahead and push back towards the kitchen there. Yes, it's true, we have a kitchen back there. Okay, so that's why I said that. I know you're jealous and hungry just watching this ileocecal valve demonstration. Push back. Okay, so nothing changed when she put her hands there. When she puts her hands there, it's called therapy localization. Long story of what that means, but basically it tells you, it's like GPS locator. It tells you where the problem is, but not what the problem is. So we don't know anything at this point, other than that she has a lot of pain in that calf, not a lot on that calf. Maybe she does have this, maybe she doesn't, except I know she does because I've studied this for quite a while. And then try closing your eyes and keeping them closed and push back towards the kitchen, breathing. Okay. Now that all of a sudden the muscle's working, right? And push back towards the kitchen, breathing. Okay. Wait, don't stop. Push, push. Okay, so open or closed eyes, either one is fine. So now we know a lot of information for this little explanation, but this is something called small intestine awake and small intestine asleep. This is, I understand this through the International College of Applied Kinesiology and their 100-hour courses. It's a postgraduate education course that I've taken a number of times.